afternoon. I'm Sayukta, your host for today's live from All About Skin Wellbeing team. और मुझे पूरी उम्मीद है कि आप सब अच्छे होंगे। आज हम बात करेंगे स्किन हेल्थ की और इस पे भी हमारा फोकस होगा अर्टिकेरिया पे, जिसे हाइव्स भी कहा जाता है। और ये बहुत कॉमन है, कहा जाता है कि सबको ही कभी ना कभी हाइव जरूर हुए होते हैं। अर्टिकेरिया राउंड रैश होता है जो हमारी स्किन पे होता है और बहुत ज्यादा इचिंग इसमें होती है। कई बार जो अलग अलग फूड आइटम्स होते हैं उसमें कुछ केमिकल्स होते हैं जिनकी वजह से ये हो सकते हैं। सर्टेन मेडिकेशन से एलर्जी की वजह से भी हो सकते हैं। जो कीड़े हमें काटते हैं कई बार उन स्टिंग्स की वजह से हो सकते हैं, सनलाइट की वजह से हो सकते हैं, वेदर चेंज की वजह से हो सकते हैं। बहुत सारे रीजंस होते हैं जिनसे अर्टिकेरिया हो सकता है। एक रिपोर्ट जो इंडियन जर्नल ऑफ डर्मेटोलॉजी, वेनेरोलॉजी एंड लेप्रेसी में पब्लिश हुई, उसमें ये कहा गया कि 1/5 ऑफ आवर पॉपुलेशन सफर अर्टिकेरिया एट वन पॉइंट ऑफ टाइम। 60% ऑफ जो पेशेंट्स हैं वो 20 to 40 इयर्स के होते हैं और ओल्डर एज ग्रुप में ये इंसिडेंसेस हायर होते हैं। अक्यूट आर्टिकेरिया, क्रॉनिक आर्टिकेरिया, इन सब पर आज हम बात करेंगे। और ये जो डिजिटल वर्ल्ड है इनकी वजह से और आसान हो गया है कि हम ऑनलाइन ही एक एक्सपर्ट डर्मेटोलॉजिस्ट से इस पर बात कर सके। तो आज हमारे साथ हैं डॉक्टर राजीव कुमार। आप पटना से लाइव हमारे साथ जुड़ रहे हैं और आप हमें अर्टिकेरिया और उसके मैनेजमेंट पर हमारे बात करेंगे। डॉक्टर राजीव कुमार इज MBBS MD in dermatology, venereology and leprosy, RIMS Ranchi, senior resident NMCH Patna। आप गोल्ड मेडलिस्ट भी हैं। बहुत बहुत स्वागत है डॉक्टर राजीव कुमार आपका।
थैंक यू।
डॉक्टर राजीव, आज हम एक बहुत ही इम्पोर्टेंट टॉपिक पे बात कर रहे हैं और ये बहुत इम्पोर्टेंट इसलिए है क्योंकि ये बहुत कॉमन भी है, अर्टिकेरिया। सबसे पहले तो आपसे जानना चाहेंगे अर्टिकेरिया क्या है, एक आम इंसान इसे किस तरह से समझ सकता है?
अर्टिकेरिया इज आल्सो कॉल्ड हाइव्स, जो आपने ऑलरेडी कहा है, इसको हाइव्स भी कहते हैं। बट जब पेशेंट हमारे ओपीडी में आते हैं तो वो कहते हैं कि सर लाल लाल चकत्ता जैसा हमारे शरीर में बनता है। दैट इज रेज इची लीजन एसोसिएटेड विथ इचिंग, रेज लीजन एसोसिएटेड विथ इचिंग ऑल ओवर द बॉडी एंड इट स्पॉन्टेनियसली सबसाइड विद इन द पीरियड ऑफ 24 आवर्स। खुद से 24 आवर के अंदर ये खुद से स्वतः चला जाता है। तो पेशेंट हमारे पास कंप्लेन लेके आते हैं कि सर चकत्ता चकत्ता जैसा आ रहा है, खुद से आ रहा है और अपने से 24 आवर्स के अंदर चला जा रहा है। तो ये कॉमन डिजीज है ओपीडी में, डे टू डे बेसिस में। इसके बहुत सारे कारण हैं, जैसे आपने बताया इन्फेक्शन, ड्रग, समटाइम्स वेनम, स्टिंग। देयर आर सो मेनी कॉज ऑफ एक्यूट अर्टिकेरिया एंड there is also chronic urticaria. The duration of the disease is very important. If a patient comes with a period of duration of less than 6 weeks, then we call it acute urticaria. If the duration of the disease is more than 6 weeks, then we call it chronic urticaria.
Right.
The acute urticaria responds very well, and the prognosis is very good, especially in case of children. Because parasitic infection is more common in children, so we can cure it properly, and the acute urticaria can be subsided with the treatment. While other side, that is chronic urticaria, is very difficult to treat. Patients complains that plaque lesion is coming over a period of 1 to 2 years, and the most important thing is the cause is not known in case of chronic urticaria, especially in case of chronic spontaneous urticaria.
Okay.
Most of the time cause is idiopathic. So this is a type, only acute, chronic, and another one is inducible urticaria. That is a specific stimulus is present at the time of formation of urticaria, such as heat, light, cold. This is the basics. We deal with the urticaria patient.
Right, doctor. Doctor, as you said, many times patients come to you और वो आपसे ये कहते हैं कि हमें चकत्ते हो रहे हैं, लाल चकत्ते हो रहे हैं, बहुत ज्यादा खुजली इसमें हो रही है और ये अपने आप गायब भी हो रहे हैं। बहुत बड़ा कैरेक्टरिस्टिक्स यही है कि वो जैसा कि आपने कहा कुछ घंटों में वो गायब भी हो जाता है, चला भी जाता है। Then why should we actually go and see a doctor? क्या ये बार बार आता है इसलिए जरूरी है कि जब ये आए तो हमें डॉक्टर को दिखाना चाहिए?
In urticaria case, there is a severe itching. there is a severe itching, and sometimes this is associated with angioedema. Angioedema also comes under urticaria. In angioedema, there is a deep swelling which involves upper lips and the genital area and around the eye. That is that's why it is more. And in case of angioedema, it is more painful than itching. And itching is very severe, so patient comes to the doctor for the treatment.
In angioedema, can it be life-threatening or very serious? Can it go to that level, doctor?
No, very rarely it can go up to that level. Otherwise, such possibility is not there.
But due to the itching, definitely the quality of life is compromised. So it becomes very important that a patient should go and consult a doctor in case they see these red bump rashes or urticaria. डॉक्टर ये भी आपसे जानना चाहेंगे, अलग अलग तरह की एलर्जीज की वजह से भी अर्टिकेरिया होता है। आपने बताया बहुत सारे कॉजेज हैं और कई बार तो कॉज पता भी नहीं होते हैं, तो ऐसे में रीजन या जो कॉज है उसे डायग्नोस करना बहुत जरूरी है। जब एक पेशेंट आपके पास आता है तो क्या जस्ट क्लिनिकल इन्वेस्टिगेशन से फिजिकली देख के ही आप बता देते हैं कि ये अर्टिकेरिया है, या उसके लिए कुछ टेस्ट भी डायग्नोस करने के लिए किए जाते हैं?
फर्स्ट ऑफ ऑल, अगर मोस्टली अगर बच्चे आते हैं तो मतलब उनमें हम लोग वी गो फॉर पैरासिटिक इन्फेक्शन, वन ऑफ द कॉमन कॉज फॉर अर्टिकेरिया, स्पेशली सर्कोप्टेसिस स्केबियाई, that is the cause of scabies. That is parasitic infection is more common. Even food allergy is very common for acute urticaria, such as nuts, fish. That is also responsible for the cause of acute urticaria. Even sometimes drug, mostly aspirin, that causes the degranulation of the mast cell, and that releases histamine. That histamine is responsible for urticaria. So some drug directly activate mast cell. That is also responsible for the cause of acute urticaria. So if it is of duration is very short, within the period of 6 weeks, urticaria can be treated very well, and response is very good. But if it is case of chronic urticaria, treatment is for a long period of time, and the prognosis is not too good. Especially in case of chronic urticaria, when we deal with the chronic spontaneous urticaria, mostly the cause is idiopathic. Sometimes it has been seen that thyroid disease, liver disease is associated with chronic urticaria, and sometimes autoimmune disorder. Autoimmunity is acting as body itself on immune cells that is responsible for chronic spontaneous urticaria. In that case, it is very difficult to treat, and treatment is very long period of time. So mostly patient tries to go, sir, कब ठीक होगा, कितना time लगेगा? Yes, many times.
Right. So does it go away permanently, or the treatment can go on for a really long time, doctor?
If it is the first time, in case of chronic urticaria, if patient goes for treatment, antihistamines is the drug of choice. Antihistamines is the first line of treatment. Mostly, preferably second generation antihistaminic is preferred. That is levocetirizine, due to the less sedative effect of the levocetirizine.
Right.
But especially in case of pregnancy, we don't go for levocetirizine. Within the first trimester of pregnancy, we prefer chlorpheniramine, and after 3 months, we can go for cetirizine and loratadine.
Okay.
And in case of chronic spontaneous urticaria, the duration of the disease is up to 4 times, up to 3 months, and we can increase the dose of antihistaminic up to 4 times. If a patient is not responding to levocetirizine 5 milligrams, we can increase the dose by 4 times.
Okay. Now, doctor, it's a very common practice in our society. In case we get some kind of allergy, as you said, urticaria is also allergy. It can be due to many other allergies, allergy to food, allergy to medicines, etc., etc. What we normally do is to go to a chemist and buy some over-the-counter anti-allergens, right? Because people are so aware these days. How okay a practice is it to, just go and buy a over-the-counter relief?
Antihistaminics is the over-counter drug because it gives relief to the patient at that time, but it is not good. because the dose is very matters at that time. In case of pregnancy, I have seen the coax is giving hexavanadine in a pregnant female. That is wrong for the patient and wrong for the patient. And also he gives patient 2 to 3 tablets, and the disease again comes when the action of the drug is finished, completed.
Right.
The patient then comes to the doctor after taking the treatment from the local quacks or doctors.
Right. So we should avoid going for over-the-counter medication or quacks, etc., or influencers. We need to go and consult a qualified dermatologist if we get to see these urticarial rashes on our body, on our skin, etc. डॉक्टर, आपने कहा कि प्रेगनेंसी में तो बहुत ही ज्यादा डेंजरस है अगर हम ओवर द काउंटर मेडिकेशन के लिए जा रहे हैं। बहुत जरूरी है कि हम एक डॉक्टर के पास ही जाएं। अर्टिकेरिया खास तौर पे जब प्रेगनेंसी में होता है तब एज अ डॉक्टर आप क्या प्रिस्क्राइब कर सकते हैं, क्योंकि हम जानते हैं कि प्रेगनेंसी में या लैक्टेटिंग वुमेन के लिए कई बार बहुत सारे मेडिसिन या टॉपिकल एप्लीकेशंस परमिसिबल नहीं होते, तो फिर किन चीजों का ध्यान आप रखते हैं एज अ डॉक्टर?
First of all, if a patient comes with urticaria within a period of three months, we go for Avil, that is chlorpheniramine tablet, is the safest drug given to the pregnant female. If a patient comes with a pregnancy of more than 3 months, then we go for cetirizine or loratadine tablets. In case of pregnancy, urticaria is sometimes may be seen due to increased bile acid, that is physiological changes seen during pregnancy. So we give deoxycarbonic acid in patient presenting with urticaria at that time. And calamine lotion is topically used for relieving the itching caused due to the urticaria.
Right. What are the potential complications of urticaria, doctor, if left untreated?
Sometimes after a long period of time, it disrupts the sleep cycle of the patient. Patient has anxiety, depression, everything happens to that patient, and in sometimes the anaphylactic reaction may occur. That is dangerous. Otherwise, it's a spontaneous subside by 24 hours acute urticaria, and patient taking the drug from the market, cetirizine, everything, the urticaria subsides by taking the treatment.
इसीलिए बहुत जरूरी है कि हम सही ट्रीटमेंट ले, सही जगह से ले, यानी क्वालिफाइड डर्मेटोलॉजिस्ट से संपर्क करें। Doctor, can urticaria be caused by stress or can it be exudated by stress?
Urticaria can be exacerbated by stress because it is the immunity that is responsible for the causation of the urticaria. So sometimes certain cytokines that causes the release of histamine in case of stress. So that's may be responsible for the exacerbation of the urticaria.
Okay. Many times patients complain that their urticaria becomes worse during night. Is there a correlation between that, or what may be the probable reason for that?
Because patient is taking rest at the night, and that time patient wants to sleep, and that urticaria associated with itching that disturbs his sleep. So patients complain of that it is not doing good at the night.
Right. और दिन के वक्त कई बार हम प्री ऑक्यूपाइड होते हैं मोस्टली, तो इसलिए शायद उतना ध्यान नहीं जाता है, लेकिन रात के वक्त क्योंकि हम एक रिलैक्स मोड में होते हैं.
Sometimes acute urticaria is associated with scabies infection. Scabies is the most common cause of urticaria for acute urticaria, and patients comes with a doctor that I am suffering from acute urticaria. पित्ती निकलता है. That time the scabies is the most associated with urticaria is associated with scabies, and scabies is responsible for nocturnal issue at that time. If we treat scabies, urticaria subside by after getting treatment for the scabies.
राइट. आपने बताया कि अर्टिकेरिया बहुत सारी वजहों से हो सकता है. अभी आपने मेंशन किया कि ये बहुत जरूरी है, अगर वो स्केबी से है तो हम उसे ट्रीट करें. तो कितना जरूरी है कि जो अर्टिकेरिया के पेशेंट्स आपके पास आते हैं तो पहले आप डायग्नोसिस करते हैं कि इसका रूट कॉज क्या है, फिर आप उस कॉज को ठीक करने की कोशिश करते हैं डॉक्टर जो इसको ट्रिगर करता है?
Especially in case of acute urticaria, streptococcal infection, viral infection is the most common cause of acute urticaria. We ask to take the history from the patient that you have sore throat within a period of 1 to 2 days, or you have nocturnal itching. If you have a family history of nocturnal itching, by the taking the history, we rule out the cause of acute urticaria. Especially in children, it is very easy to rule out the cause of urticaria.
ओके डॉक्टर, चूंकि हम अर्टिकेरिया पे बात कर रहे हैं, कुछ सवाल भी जो हमारे व्यूअर्स हमसे पूछ रहे हैं वो भी हम लेते जाएंगे। हमारे साथ वंदना है, पूछ रही है, will my chronic idiopathic urticaria ever go away? And this is a very common question which normally patients with chronic urticaria ask, that will it ever go away permanently? What's your answer to that, doctor?
It is very difficult to tell the answer as a doctor for me, because it is a cause is not known that in certain condition. We are just stabilizing the mast cell, which is responsible for the causation of the chronic urticaria. Whatever we drug give, that is responsible for the stable to make the immune cell stable, especially the mast cell. Everything, whatever happens in urticaria, it is due to the histamine release from the mast cell, and whatever drug we give, that we stabilize the mast cell to prevent the degranulation of the mast cell. So it is very difficult to tell the answer as a doctor, if urticaria will go or not. But some patient after treatment taking for a period of 3 months, starting antihistaminic only and along with Montelukast combination, some patient tells that, sir, after taking the treatment for 3 months, my chronic urticaria subsides. Or recently, too many drugs, immunomodulatory drugs have come to the market, which has more beneficial effect than old antihistaminics in case of chronic urticaria. We go for cyclosporine, which has better result in comparison to antihistaminics. That is third line drugs. Recently, drugs is omalizumab. That is also a better drug for chronic urticaria. I have given cyclosporine for a patient for chronic urticaria. Response is very good. Patient doesn't come after taking treatment for three months. He comes to me after 2 years. That's suddenly say fixes chronic urticaria मेरे को होने लगा. मतलब the response of drug was very good in case of chronic urticaria, especially cyclosporine.
राइट कई बार ये होता है, मैं आपसे ये जानना भी चाह रही थी डॉक्टर कि पेशेंट ने क्रॉनिक अर्टिकेरिया से सफर कर रहे हैं, उन्होंने आपसे ट्रीटमेंट लेना शुरू किया, कुछ टाइम उन्होंने ट्रीटमेंट बिल्कुल रिलीजियसली फॉलो किया एंड फिर उन्हें लगा कि अच्छा अब तो थोड़ा रिलीफ मिल गया है, और बिना आपको बताए, बिना डॉक्टर से कंसल्ट किए उन्होंने वो ट्रीटमेंट बंद कर दिया। फिर कुछ महीनों बाद उनको लग रहा है कि अच्छा नहीं, फिर से अर्टिकेरियल लीजन्स हो रहे हैं, फिर से उन्होंने, क्योंकि प्रेस्क्रिप्शन तो है, फिर से वो गए दवाई लेकर आए, उन्होंने प्रेस्क्रिप्शन खुद से ही शुरू कर दिया, वो आपके पास आए नहीं। Only when the situation goes out of the control is when they'll go to you and ask कि मुझे वापस से ये होने लग गया है। I'm sure इस तरह की चीजें होती होंगी। My question to you, doctor, is that how important it is to keep in touch with the doctor or follow the prescription. How important is that?
When you have to start the treatment for chronic urticaria, the duration of the treatment is very long, around 3 months. If you are only giving antihistaminic, it should be given continuously for a period of 3 months. But patients left the treatment after taking relief from the urticaria, so it's very difficult to treat the patient, especially in case of chronic spontaneous urticaria.
Right. तो इसीलिए पूरा जो आपको प्रेस्क्रिप्शन दिया है, जो आपका ट्रीटमेंट है, उसे पूरा करना बहुत जरूरी है। ट्रस्टिंग योर डॉक्टर इज वेरी 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 इंपॉर्टेंट एंड दीज डेज डॉक्टर, एज वी वर टॉकिंग अबाउट क्वैक्स एंड ओवर द काउंटर मेडिकेशंस, देयर आर सो मेनी इन्फ्लुएंसर्स on social media, right? And they have so many options or home remedies to cure urticaria or give some immediate relief. What's your take on those influencers? Many times we also ask our friend or family who have gone through the same thing, will even go to this extent that will take their prescriptions, buy the medicines and start popping them in. So how is it okay, or how dangerous it could be?
I have seen a case of leprosy with type 2 reaction. He was treated by quacks for a period of 2 years as a case of chronic urticaria. Patient with leprosy with type 2 reaction, he was treated by quack as a case of chronic urticaria for 2 years, and he is taking antihistaminics a period of on and off for a period of 2 years. this is the scenario of the quacks who is giving antihistaminics for 2 years for a case of Hansen disease with type 2 lateral injection. And the second is he preferably goes for Dexona, which is comparatively better drug at the time of acute urticaria for a short period of time. So when acute urticaria patient goes to a quack, he directly starts Dexona 1 vial IVBD for 7 days, 10 days. Then this is very difficult situation, and the side effects of corticosteroid is well known to us. So it should not be done because chronic urticaria is a chronic process for a period of 2 years, and he is taking steroid injection per week for a period of 2 years. It is very difficult to treat at that time.
हम जितनी जल्दी एक डॉक्टर से संपर्क करेंगे, एक सही स्पेशलिस्ट से संपर्क करेंगे, उतनी जल्दी हमें आराम मिलेगा, उतना इजी हमारा ट्रीटमेंट होगा। हम जितना खुद से एक्सपेरिमेंट करके चीजों को कॉम्प्लिकेट करके डॉक्टर के पास पहुंचेंगे, जो नॉर्मली हम लोग करते हैं, होम रेमेडीज ट्राई कर लेते हैं, इन्फ्लुएंसर्स की सुन लेते हैं, ओवर द काउंटर मेडिकेशन कर लेते हैं, उसके बाद जब चीजें हाथ से निकल जाती हैं, आउट ऑफ कंट्रोल हो जाती है, तब हम डॉक्टर के पास जाते हैं और उनके लिए भी फिर बहुत ज्यादा मेहनत हो जाती है वहां पे, और हमारा जो ट्रीटमेंट है वो बहुत लंबा हो जाता है। तो इसलिए बहुत जरूरी है कि हम इनिशियली ही जब हमें लगे कि हाँ हमारे साथ ये हो रहा है, तभी हम डॉक्टर से संपर्क करें। और ये पूरा सेशन करने का एक बहुत बड़ा उद्देश्य ये भी है कि हम लोगों को अवेयर कर सके कि अर्टिकेरिया क्या है और कितना जरूरी है डॉक्टर के पास जाना, एक क्वालिफाइड डर्मेटोलॉजिस्ट के पास जाना। हमारे साथ फारिया इस वक्त हैं, हमारी एक व्यूअर हैं, पूछ रही हैं, which food should I avoid if I have urticaria?
Especially cow milk, fish, nuts, strawberry, tomatoes. These are common food items which can cause urticaria. That contains vasoactive amines, that is histamines. That's why that histamine is responsible for causation of the urticaria. So that food should be avoided.
तो ये सबके लिए डॉक्टर, और only those who are allergic to these food items?
Only those who are allergic to these food items.
Because why I'm asking this many times, even if I never had urticaria, for example, but I'll stop eating all this because I know that these may cause food, because I may get allergic to these, and these may lead me to urticaria. So that is not a good practice to do, right?
I am telling the pathophysiology, which is mainly responsible for urticaria. When first time an allergen is encountered with our immune cells, there is a formation of antibodies, IgG antibodies. When such that binds to the mast cell, when second encounter with that same allergen, that will cause linking of the immunoglobulin IgE, and that causes the degradation of the mast cell. So at the first exposure, you may not suffer from acute urticaria, and if you are not suffering from at the first time acute urticaria, the chances is less. In sometimes urticaria having adult onset, that is very difficult to treat. If it comes in adult age, it is very difficult to treat at this time.
Right. एक और सवाल है मेरा इसी से related, doctor, because these days, these allergy tests are equally easy to do and they are trending. Now, what people do, they'll not go to the doctor, they'll immediately by themselves go to these labs and get their food allergy test done. They are expensive at the same time. फिर वो report लेके डॉक्टर के पास जाते हैं कि we are allergic to these 50 things. So what should we do? What's your take on these allergy tests?
मैंने आज तक कभी किसी को एलर्जी टेस्ट करवाने नहीं कहा, रियली, बिकॉज जितने भी पेशेंट को स्टार्टिंग में मैंने एलर्जी टेस्ट के लिए कहा, अराउंड 50 to 70 his allergens are present in that test. It is very difficult for anyone to leave 50 items in your life.
Right.
So that's why I never preferred allergy test for the patient. If someone forced me to do the test, I allow for that. You can do it if you want to do it.
Right. तो अर्टिकेरिया ठीक हो ना हो, लेकिन ये आप कुपोषित जरूर हो जाएंगे, तो इसलिए इस तरह से बिल्कुल ना करें कि पहले एलर्जी टेस्ट करा लिया और फिर जो आइटम्स हैं उन सबको अपने थाली से ओमिट कर दिया, फिर डॉक्टर को दिखा रहे हैं। हमेशा सबसे पहले क्वालिफाइड डर्मेटोलॉजिस्ट को दिखाइए, वो जो टेस्ट आपको बोले वो कीजिए। नॉर्मली व्हाट टेस्ट यू सजेस्ट, वी हैव ऑलरेडी स्पोकन अबाउट इट डॉक्टर, बट देयर आर मेनी व्यूअर्स हु आर currently joined this session and is trying to know कि नॉर्मली कौन से टेस्ट डॉक्टर करवाते हैं अर्टिकेरिया के लिए।
और बेसिक इन्वेस्टिगेशन, रैंडम ब्लड शुगर, LFT, KFT and routine examination of urine. A specific test will go for thyroid test. That is one of the common causes for urticaria.
Right.
We go for thyroid in every patient almost in case of chronic urticaria.
Okay. जैसा कि हमने बात की कि अलग-अलग तरह की एलर्जीज की वजह से भी हमें ये हो सकता है अर्टिकेरिया। क्या क्योंकि या तो मुझे पहले से पता हो दैट आई एम एलर्जिक टू एग और जब भी मैं एग खाती हूँ तब मुझे ये अर्टिकेरियल रैशेस होते हैं, तो मुझे एक पैटर्न पता है। पर पहले से मैं किसी चीज़ से एलर्जी नहीं हूँ और सडनली मैंने देखा कि मैं जब भी कैश्यू खाती हूँ या कोई नट्स खाती हूँ, आई एम ट्राइंग टू सी अ पैटर्न कि जब मैं ये खाती हूँ तब मुझे ये हो रहा है या जब मैं ये मेडिकेशन ले रही हूँ तब ये मुझे रिएक्ट कर रहा है। तो क्या किसी तरह से ये चीजें ताकि मैं डॉक्टर के पास जब जाऊँ तो उनसे शेयर कर सकूँ, डायरी रखना या इस तरह से कुछ हम कर सकते हैं जो आप सजेस्ट करते हैं नॉर्मली पेशेंट को?
If urticaria occurs at the first time, it is very easy to rule out the cause of urticaria. So I always tell the patient, don't go for the chemist, always go for doctor. It will help you to rule out the cause of urticaria. And if it is removed at that time, you will not suffer in the lifetime acute urticaria or common chronic urticaria. Because if you know that I am after taking milks, I am suffer from urticaria, then you should avoid cow milk from the diet. So if the urticaria at the first time, always rule out the cause. Why this happens to me? Then it is very easy to rule out the cause, and you should avoid that cause, especially in case of food.
राइट। तो किससे ट्रिगर हो रहा है, क्या हमारा रूट कॉज है, ये पता करना बहुत जरूरी है और इसके लिए बहुत जरूरी है कि हम डॉक्टर के पास जाएं। ओवर द काउंटर मेडिकेशन या कुछ और करेंगे तो हम कभी कॉज तक पहुंच नहीं पाएंगे और कब हमारा एक्यूट अर्टिकेरिया क्रॉनिक में तब्दील हो जाएगा या वो उसका ट्रीटमेंट कितना कॉम्प्लिकेटेड हो जाएगा ये हम समझ ही नहीं पाएंगे। तो बहुत जरूरी है कि हम एक क्वालिफाइड डर्मेटोलॉजिस्ट के पास जाए। कई बार पेशेंट ये भी कंप्लेन करते हैं दैट दे फील वेरी टायर्ड और फटीग, बिकॉज दे हैव दीज अर्टिकेरियल रैशेस। वो कंटिन्यू इच करते हैं, दे स्टॉप सोशलाइजिंग, दे स्टॉप गोइंग इन पब्लिक प्लेसेस एटसेट्रा बिकॉज दे फील रियली एम्बैरेस्ड। तो ऐसे में जब पेशेंट्स आपके पास आते हैं तो आप उनसे क्या कहते हैं? आई एम श्योर बहुत सारे हमारे ऐसे व्यूअर्स होंगे जो सफर कर रहे हैं बट दे आर नॉट coming up to tell anybody that I'm having this problem, probably because they don't know that there is a solution to it.
Especially in case of severe urticaria, when the number of lesions is more than 50. When the lesion is more than 50, it disturbs the sleep cycle of the patient. मतलब पेशेंट को नींद ही नहीं सही से प्रॉपर से आता है। If they do not take proper rest, weakness तो लगेगा ही लगेगा पेशेंट को। If they don't take proper rest at the night, weakness comes to the patient. That is the reason behind the weakness of the patient. They suffer from depression, anxiety, whatever they suffer from that, and that is the cause of weakness. Otherwise, acute urticaria is not the cause of weakness. That is the sleep, disturbed sleep, that is responsible for the cause of weakness at the patient of urticaria.
Right. हमारी एक व्यूअर है कीर्ति, पूछ रही है, does vitamin D helps in urticaria, helps in the cases of urticaria?
If vitamin D is deficient, then sure you should correct it. One of the cause of urticaria.
In last 2-3 years, due to COVID, we have seen a lot of patients complaining that when they, had COVID, they also had these hives or urticaria. Is there a relation between these, COVID and urticaria?
Maybe research has not been done correctly. Sometimes, but it has been seen that the number of urticaria cases has been increased many times. This may be due to the autoimmunity factor.
Right. Kirti Kapoor is here, a viewer, asking, what is your advice for toddlers with urticaria?
You should give proper antiparasitic drug, especially albendazole or ivermectin, within a period of 6 months, and you should avoid the food. After taking that, child develops urticaria, you should avoid that drug, and you should toddler should wear cotton clothes instead of synthetic clothes.
Okay. Are there any dietary precautions or do and don'ts for patients of urticaria? Doctor, few food items you have already said, but are there other things like the preservatives, colors, etc., anything that we should avoid?
This preservative, some outside product that contain preservatives, that should be also be avoided.
Okay, right. Before we sum up the whole session, Doctor, anything about urticaria that we have missed out on, or any take-home message for our viewers?
Take-home message that if you come to the doctor at the first time and always rule out the cause, what is the cause of urticaria? It will be very easy to treat for a doctor and as well for the patients. Secondly, you should rule out the food that causes the urticaria, especially cause milk, fish. You should avoid the food and certain drugs that can cause urticaria that binds to the muscle and causes degranulation of the muscle. So you should avoid that drugs, especially I am mentioning one drug that is codeine and aspirin. You should avoid that drug. And sometimes urticaria comes by after sweating. So you should do less work that should not sweating doesn't sweating नहीं आ सके इस तरह से करना मतलब core body temperature आपकी नहीं बढ़नी चाहिए at that time that's करना चाहिए और आपको synthetic cloth आप wear करते हैं तो आपके लिए मतलब patient के लिए अच्छा है जिनको urticaria हो रही है. This is a take home message for the patient.
Okay, doctor. Thank you so very much, Dr. Rajeev, for your valuable time. It has been a very informative session for our viewers, and I'm sure they'll use this information to prevent themselves and their near and dear ones from getting urticaria. And in case if they get to see such symptoms, they at least now know that instead of self-medication or talking to a friend or family, it's better to approach a nearby dermatologist. It was great to hear you. Thank you so very much.
Thank you. Thank you.
Viewers, thank you for your active participation in today's session. To get latest updates on how to keep your skin healthy, do like and follow our FB page, all about skin well-being. We are also available on YouTube, Twitter, and Instagram. Thank you. Good day. Bye.